would like your assurance that any other member of the medical team be tested immediately. I had an operation at your hospital last year. I demand an immediate blood test.
Anaesthetists with HIV or AIDS are at liberty to continue to practice, since our work does not involve the sort of invasive procedure which might be a risk to patients or staff, specifically the use of sharpened instruments inside body cavities. I have volunteered to keep away from patients until the hospital receives the official guidance of the Director of Public Health. You know I will receive her full support.
Following the albeit reprehensible disclosure of your diagnosis, I fear you're being willfully naive, not to expect repercussions.
Against the hospital, you mean, from rabid journalists and ignorant counsellors?
I will not be an apologist for hysteria.
Then stop acting like one.
No, I'm sure everything will be all right, Phil, but I mean, at a time like this, I mean, it might have been wise if you'd had private insurance after all. Oh, Andrew, unfortunate news.
What's that?
The inquest's been brought forward.
James, you know, with you being, have you ever where I was concerned?
What?
Have you ever had thoughts where I was concerned?
What?
Have you ever fancied me?
Rest assured, I'm one of the few people in this country who's never taken a passing interest in your backside.
Good. Hang on. How come? If I got on as well with a girl as I did with a mate, she'd have to be a right tugboat for me not to fancy her.
Raj, it's Jackie. Can you look after her?
Yeah, sure.
Raj, it's my daughter. She's got an abscess on her bottom.
Nasty abscess, that. Looks like we're going to have to cut off your whole bottom.
Not quite. It's a perianal abscess. I reckon we can tee up surgery for sometime this Arvo.
Don't forget to tell the anaesthetist about her asthma.
I won't, Jackie. Try to stop being a nurse and just be a mum.
Sorry. I know she's in good hands.
See you.
See you, Shan. See you. I see the hospital being their usual soft touch over sick leave.
So much for this crap about macho doctors not accepting their own illnesses. It's more like no one else will let you accept it.
They only ever granted a sickie to one of the juniors, and then only on account of her being dead.
See you.
See you.
I mean, he was given I was born yesterday, not to notice he'd taken blood tests from my son. I could have him charged with assault, you know.
Scissors? Those useless med school lectures will be fresher in your memory than mine. The inheritance of blood groups. If her father is, let's say, blood group AB.
His children's blood group would be A or AB.
Or B, but not O. I thought so. Thanks.
Wardell staff nurse Dalton. Thanks. Theatre's a sender for Sharon Landis.
Her stats are dropping like a stone.
Get up.
Atropine sucks.
I mean, what bothers me most is that I've stopped being a person and I've become an issue.
We need an anaesthetist in theatre.
Sorry, not me.
She went into laryngospasm after the first incision.
Okay. Back to 100% oxygen.
She had 0.6 of atropine and 50 of SOX.
Sorry, you did the right thing. No one ever died from not having a tube, only from not having enough oxygen. The sats are coming back up. Okay. Together. Sorry, you've had a scare, Nick, but no harm done. Sorry for desterilising your theatre.
Our sister. You know she's in very good hands.
Sharon's fine.
Did you get involved?
I'm glad you did.
Me too.
They're taking her to HDU just as a precaution.
Okay.
They've got you now, my boy. I feel very sorry for the lad. Easily one of the more capable members of that shower that call themselves anaesthetists. I'm grateful to be leaving this bizarre setup where the mice have begun to run the experiment. A grateful valediction indeed, Isabel. In my day, manager...
Enough. Ernest, I've no wish to share in a dotage of, if only, what might have been, the good old days. Either you accept the fact that your time is past, or you stay and you fight. I know for which I'd respect you more.
No, of course I don't want to go back to being someone's assistant. Well, I take it my protest has been noted. Thank you. Come in.
Paul?
Oh, I know how busy you two are, so I'll get straight to the point. This administration cannot afford for tomorrow's hearing to become an inquest into how this hospital is run. It should be Dr. Kirkby, guilty or not guilty.
Oh, lone assassin.
I'm sorry, Barry.
An unbalanced individual acting alone. No shot from the grassy knoll. A single bullet ricochets halfway around Dallas before embedding itself in the president's head. No conspiracy there, that's for sure. Come on. You're doing it again. Making a scapegoat of Phil Kirkby. I'm sorry, I'm having no part of it.
Now, Barry...
No, Graham. I've heard enough.
Phil is a good lad who's worked well for me these 6 months. I'm sure he'll see reason.
Whether he falls or he's pushed, he takes a dive. Oh, my God, Graham. I thought I came here to get outpatients seen on time.
James!
Mr. Doherty, may I say how pleased I am to learn about your change of heart?
One moment, Mr. Tennant. I'm merely willing to reconsider my position vis-à-vis retirement. There is one condition.
Name it.
James Mortimer. You leave him be.
Hi. Hi. I checked on the ward and he's taken the result. Yes, thank you.
That's okay.
Anything that stops Adrian DeVries from finding out that Stephen really is his son has got to be worth it. Anyway, I think that one bastard in the family is quite enough.
Sit down, Phil.
I expect you're nervous about tomorrow. Don't be. It's all taken care of. Now, these are the notes of Mr. McIntyre, the patient who died due to your error. I would like to draw your attention to the last entry in your hand. Discussed with Dr. Turner, advised to continue. It was Christmas Day. I'd partaken of one sherry too many, perhaps. Possibly I wasn't communicating with my normal clarity, and so you misunderstood.
We expect you to admit responsibility for Mr. McIntyre's death owing to your ineptitude. We expect you to deny that long hours or incomplete training contributed to your error.
Well, I hope you'll forgive me not liking the sound of your plan.
Our plan? No.
If there is a financial settlement,